Good morning, everyone. So this is the provider engagement report demo portion of our session this morning. And the demo is going to be via PowerPoint. It's not going to show you the live session for two reasons. One, we have a mixed group here and I don't want to show PHI. So in the PowerPoint, I can mask things. And also we're in the final stages of testing and fixing a couple bugs in our version 1.8. And so I've taken screenshots of that I want to show you so that when you log in the next couple of weeks and we've pushed that version, you know what you're seeing. So first, our intent with the provider engagement report was to make it as easy as possible for you. We know it's not going to be a system you're logging into every day. You'll figure out what schedule makes sense for you in your practice, but we wanted it to be easy for you to find and easy for you to navigate through. So go to AHP's website. In the upper right-hand corner, there's a green call to action button called Provider Engagement Report. When you click on that, it's going to take you to a page on our website dedicated to this, this tool. And it's going to be where we share our quick reference guide, any guest account facts, so that we're taking you through the creation of guest accounts right now. But if you need to request a new user in the future who's joined your practice, this is the steps in this that you don't need to save an old email. If you have issues with logging in, you don't remember your password or the Duo is not working, there's the information on how to contact the medical center's help desk, either via phone or via email. And then if you have questions or feedback on the PER itself, there's an email address to send to our team at AHP and then we will respond to you on that. And then lastly, there's release notes here where as we push updates, we'll be updating the document that includes what are the changes that we've made. So if you see a difference between the last time you logged in and this time, you can go out and see what exactly was behind that change. Additionally, we have quarterly updates to the server and the system. And so we will not be blasting you with emails every time we're updating the system. We will put a maintenance message on this page so that if it is a day you're going to be logging in and it's not a successful login, be sure you check back to this page and see if it's under maintenance. And if not, then reach out to the help desk or AHP's team and we'll work with you to get you access. The other thing I wanted to mention is I talked about the medical center's help desk, and this server that we're hosting provider engagement report on is hosted on the UMC network, but it's dedicated to AHP. And your information is protected from others at the medical center and each other so that you're only gaining access to your practice's patient and even down to the level of within a practice. This account setup allows you to designate whether somebody has access to the entire practice and all the providers' information, or if you have access to only your own information. If you're part of a bigger system, then, we have quality roles where they might be seeing multiple practices. So it's a very granular security model. Oh, I'm so sorry you don't see the screen share. Click. Thank you for saying that. I will just toggle back. I didn't go too far. I just showed two screens. I'm going to go back to the first one. This is our homepage on our website, and the green button is in the upper right-hand corner. When you click in, this is the page about provider engagement report with all the links of the content I mentioned. And you can go to these now and see what's there. But as I was saying, your information in our security model is very well protected and very granular. So it's not just out there for everybody to access. So the quick reference guide, as I mentioned, we wanted to make this very intuitive system, easy to use, able to come back to it and know what to do. But there are a few things that I'll be calling out as I'm doing the demo today that I felt were important to just put in a 2-page FAQ for your future reference. So I just wanted you to see that this is here. I will point these things out as we're going along. You don't have to make notes because you can go to the website, download this document and pull it out. Page 2 of this FAQ is what is less intuitive as we go along. And actually, it's one of the most important features of the provider engagement report is being able to download the content, downloading it to a PDF report that you could print and share or save, but most importantly, taking patient lists that we provide and downloading it to Excel. And so this second page of the FAQ shows you the simplified steps of how to do this throughout the dashboard. I will also be demonstrating it in a future slide on how to download a patient list in context. So the guest account FAQ, as I mentioned, that's a linked document. And so when you need to set up accounts in the future, you can refer back to here and know who to contact to request. And then this is a quick look at what release notes look like. And so as we put out version 1.8 in the future, you'll see in the document the very most recent versions at the top of the document, the date that it was released, and then it's broken down by section, what changes you'll see in each component. So logging in. So first thing, I'm going to jump back over here. So on this page on our website, you've gone to the green button and gotten to the provider engagement report page. There's a gold button, view provider engagement report. That is what is going to link you to the login for this dashboard. So when your guest account is set up, you're going to use that username, that password, and then you're going to select on the domain here, URMC Active Directory. And that's important because there's two choices, a UR Active Directory and a URMC Active Directory. And our server is on the Medical Center network so that it's protecting PHI. So when you click sign in, you will be prompted with the Duo authentication. So would you part of your guest account setup process? And if you've been logging in using eRecord, you've already got your account and you've already got Duo set up. If you haven't been using eRecord, then you're going to be setting this up, and you can decide how you want to be prompted for that, confirming that you are who you say you are, and doing that second step in the login process. So I prefer the push. I have a little app on my phone. So when I click push, it sends me a prompt on my iPhone, and I just click approve, or it can call you and then you can acknowledge. You can push a 1 or a 2 for a yes or a no. Or if you have the app, you can look up a passcode on the app itself, enter passcode, and type in the numbers that you would be seeing there. Once you do this, though, and you approve yourself, identify yourself the second time, you log in directly to our homepage. And the homepage has been designed to give you a quick look at everything that's important. There's a lot here. I'm going to break it down, going through each component as we move along. But there's a few things I want to point out. As we go through, you'll start to see some color coding. Right now, I'm just showing you blues in our graphs. And you'll start to see greens in some of the examples I show. Green is good, and blue is an area where there's some room for improvement to meet target, to earn more reward. And those are the things that we want your eye to be drawn to. We didn't choose red for a reason. It's not bad. It's just that there's more room for improvement. Let's see. When you're logging in as an individual provider with only access to your own information, you have the ability to see some of the information at the practice level, or toggle down and see just your own. And depression screening is an example. You're logging in and you're seeing your practice level performance. And then if you click over to individual, it would see just your own patient panel performance. So you can see kind of how you fit within the whole. And some of the other components work the same way. The dashboard version number is always in the upper left-hand corner, showing you version 1.8. I think it's 1.6 that's out there right now. We're going to skip over 7. We didn't push it. In the middle, it's going to be your name and your practice name. I'm demonstrating as me, so there's some things that we're pulling up as the super user that sees everything. Underneath the title section, there's 3 squiggle lines, and this is the drop down for additional filtering. But when you go in, your account tells us who you are and what's your security. So that's the default filter that we apply to it. So if you're a provider who sees only your own information, you're going to never need to open up this section here. You're just going to be going through the dashboard, and there's really not anything else you need to do. If you are in a provider or a practice manager or a quality person who has access to more of that practice, you may want to filter to look at different things. So I'll show you a couple of examples. All the components are here. We'll talk about each one specifically. There's always these double arrows, and that's where you click to drill down into more detail around that initiative. So we'll move on. So this is an example. I have done some filtering down to a specific provider, and I have masked which location and which provider we're looking at. But now you see that we're seeing percent of reward earned, and we're seeing cost versus quality information, where on the prior page, it was telling you it's shown on a provider level. So I was going in as super user too high in the hierarchy to actually get this information that's relevant. And the same thing with cost versus quality. It was it's calculated and shown at a practice level, so I needed to drill down a little bit more. Also, because I'm down to a provider level, I can see citizenship is now populated, because citizenship is earned at a provider level, but it's based also on practice in engagement and provider level engagement, and we'll drill into that a little bit. So the first place I want to go into, and the intent of this entire dashboard, is the helping you have early visibility into your potential reward earnings. And so we don't know what the exact dollars are going to be in gain share, so we can't show this in a dollar figure. What we can show is out of 100% of potential earnings, where are you right now? And so I'm going to drill in here. This example is 44% of the earnings. This is what you will see when you click into the reward section. So this one, I'm not just showing it as an individual provider. I'm giving an example of what it would look like if you were somebody at your practice manager was logging in, or you're a system quality person. You will see a list of all providers that you have access to. If you have multiple practice locations, though, you will see a breakout there. And then if you are in a system with multiple practice groups, you would see a breakout here. So if I was just one provider, all I would see is one line across here with multiple components. What's really nice about this also is this is a dashboard that can be downloaded to Excel. And so if you are somebody that needs to work in Excel, filter things down, see where you want to target maybe a quality initiative or an end of the year dash or something to earn maximum rewards, you can certainly use this in an Excel format. But we also added the ability to filter it and just see how are you doing on citizenship, or how are you doing on depression screening, if you wanted to just focus in on that. So if you clicked on off the all and chose, say, depression screening, you'd see only one component line per provider. And you'd see what that percentage is that they're earning in that component itself. The other thing to point out on this page is that there is a reward plan, and then how are you earning towards the reward, and how much do you have left on the table? So the reward plan can be different provider by provider and practice by practice. And a couple of things that drive some of the differences are, Renee showed initially, was the specialty. You know, what does your practice do? Is it family medicine? Is it internal medicine, or peds only? And so if you're family or peds, you'll have a LARC line on here. If also in pharmacy costs, it's a variable component as well, because you may be your practice may have prescribing switch opportunities where you prescribe in one or more of the 4 pharmacy initiatives. But you may have an individual provider that doesn't prescribe in any of them. And if that's the case, that pharmacy component would be a 0 or a missing line, and that percentage of the reward that would typically go to pharmacy will get reallocated into another section. So we're always working with 100%, and we're measuring you on things you do and you have the ability to participate in. So again, the third column here is the reward earned out of what your plan was, your maximum for the component, and then the unearned is how much is left. So I'm going to click back out to the home page up, and I covered it up here, but there's a double arrow in the upper right hand side underneath this drop down. And that's what takes you back to the home page, and every single drill down works exactly the same. So now we're going to go back and we're going to look at cost versus quality. And here you're seeing this is at a practice level. Because of the data that we get from Excelis is at a practice level only. It doesn't drill down provider by provider. So how is your practice doing on quality? Overall, you're at $79.35 PMPM, and quality percent of points earned is 79%. There's no greens or blues on this page at all because there's no targets at this point. This is a conversation point. We're showing you the information so you can gauge how you're doing and also compare yourself to peers. And it's what we use to start to talk about what are the initiatives that we want to work with you on, or you want to work with us on. So we're going to drill in here and show you what this looks like. So that 79.35 PMPM, we've drilled down and separated into a pharmacy PMPM of the medications that you prescribe. And how is the pharmacy costs compared to your peers? And it's over a period of time. We'll be getting we should be getting cost reports on a quarterly basis. We have not gotten any for 2022 yet. This year, we've had some issues. And but when we do, we will shorten the window of what we're showing here and kind of have a sliding window. So you're seeing the most current things, but not too far back. Your line, we've got to add a key in here because when the lines get close, it's hard to tell what we're labeling. But the green is your practice. And the black line is your peers, and your peers are those that are practices similar to you by specialty. So if you're a family medicine practice, we're showing you what the PMPM average looks like for other family medicine practices. And then there's a little narrative that just tells you how we kind of break it down in percent above and below. We do the same thing for the medical PMPM. You can see the lines are right on top of each other in this example. So, that's really good. We're looking to see how are you doing in comparison to others. And the other bottom grid is also very insightful in that we're creating this scatter plot around your quality performance. And we've got the bronze, silver, gold in the graph, which you're familiar with. This is back to the original targets of 65% to reaching silver and 95% to reaching gold. If we adjust that because of another pandemic again, or in the future, we would adjust these down so we're seeing things in proportion. In the dark triangle is your practice and where you stand in this scatter plot. The other dots are the peers, your peers, and at an individual practice level. You can hover over and get more information about your practice. You can hover and get just what's the PMPM and the quality points for the other practices, but you don't know who they are. Those are blinded. And so what we're trying to do together is work together to moving costs lower and your quality higher. And so we want to drive everybody as close as we can at whatever pace we can into the lower right-hand section of this scatter plot. So this example is doing pretty good, right on the average PMPM line. And, we're in silver, and sure, there's room for improvement, but boy, you can see a lot of others are really struggling. And then at the bottom left-hand corner, this is the sources, which is very important because we do refresh the data at different times. And looks like there's somebody waiting to get admitted, Renee. We refresh data in these components at different times. And the quality measure snapshots we take at the beginning of every month. It's the first Monday of every month. And so what you'll see here is that, but we're only really reporting on quality 2 months back. We always look at this trailing year because it's the most complete data that we have. So you'll see this is just an example from the June snapshot. We'll tell you, I think we're doing August now. So it'd be August 2022 as of and the date that we pulled the data. Because when you go look in Arcadia, you might see something different. Again, this is just a point in time look at things. And then Excelis, the total cost of care report that we get from them that drives the PMPM is quite old right now. But when we get it and we get caught up, you'll see that this the key at the bottom will be updated as to which quarter we're showing through. I'm going to drill back out to the homepage and quality measure. Talk to this just really quickly. It says coming soon. Our intention here is to not reproduce Arcadia and the information you get in Arcadia. As we only take snapshots once a month at the beginning of the month, it's not real-time information. So it's as of the last poll we did. And our intention is as soon as we can validate V6 that we would be putting total percent of points earned in this component here. We're not going to have too much to drill down to this year. As we get into next year, we will likely break that down into the quality measures. We may pull in some trending if we can get the trending working again. And want to just be bringing this so that it's part of the big picture that you're looking at. But if you need to do gap closure reviews and see the work that you need to do to increase your percent of points earned, you need to go to Arcadia and use that interface for that. So we're going to drill in here now to citizenship. And as you can see, there's two sections. The blue donut here is that there's only 1 out of 5 of the possible engagement activities that have been complete by the practice as a whole. And so there's room for improvement. If you got to 2, then the graph would be green color, and you would have earned, the practice would have earned citizenship, that 10% of the reward for all of the providers in their practice. But they didn't. And at this point, this individual provider, though, has earned their citizenship because they've gotten more than 2 of their individual engagement activities complete. And so they've earned the citizenship on their own. And so you can drill this, you may never need to drill into because, wow, I did it. I'm going to focus on depression screening or pharmacy and see what I need to do there. But if I do want to drill in, I'm going to click the double arrows and I'm going to see this. So it shows check, yes, you've earned your citizenship. The practice requirements are going to list the ones that are on the grid for this year, and these might change slightly. I do need to add Vatica over here for the provider ones. It wasn't in there for our testing, but you can see only one of them has been selected in the practice list, and the practice list is different than the engagement activities for the providers individually. So the 3 that are checked are the ones that we've counted in the on the dashboard page. We will go back to the home page, and now we'll spend some time in depression screening. So depression screening here is showing an overall look at how we're doing. So I'm in at a provider level. This is my individual patient panel of 894. At this point, when I did the snapshot, there was 223 that had been screened. And last year, well, the target is derived from last year's performance. And so I won't get into trying to quote what it is, but we've got a help page that tells you how the target is calculated. But once we finalize the prior year, we know what your target is for the next year. So in early 2023, you'll be able to see what you're trying to do to earn maximum depression screening reward. But we are only at, we haven't hit the target for screenings yet. And so we're only at 29.4%. So we definitely want to drill in here and see what we can do. Sorry. In the upper right-hand corner, this is when was the data last refreshed? So this is done on a weekly basis. And this is just an old screenshot of mine. And it pulls from Arcadia. And we're looking at the depression screening data that's coming from your EMR. And what we have here, this is just some really big numbers at a different level. The entire panel size is 40,000 here. There's 9,000 patients screened, 14,000 that have not been in for their annual checkup yet. But that and also have not been screened. So this is our opportunity, right? We get them in and screen them at their visit. And then this last section of the graph is those that have been in for their checkups but have not been screened. And then this is really, we would want to, especially in early days here, be looking at this number and making sure it feels right. Is this truly the number that you haven't screened, or is your workflow really should be catching a lot more of this? And if so, we want to work with you on making sure that we're capturing your data correctly, that it's being tracked in the right place in the EMR, that we're pulling out, we're interpreting it right. We're having a lot of problems right now with the Arcadia process that maps the depression screening data, and we're trying a different approach to get more accuracy here. So as you start to log in and see your actual information, don't hesitate to reach out if something just is a little, doesn't pass the sniff test here. Just a little bit more about the graphs. So when you drill into the screening, how many patients were screened, what we want to have visibility to those that are positives, which is the 10 or more score in the PHQ-9. And those that are at risk. So we want to keep our eyes on those that are at risk. And then those that screen positive, we drill down a little bit further and is there been follow-up that has been documented that we have been able to capture in the data that we're receiving from you. The nice part about this graph as well is, we're going to be really focusing on the top two initially this year. And you click into any one of these sections and there's a patient list that will open up. We don't display it automatically because it slows the screen down. Especially when we're looking at things at a system level, it really affects performance. So when you decide what patient list you want to see, you would click on that section and it would display the list over here. So I'm going to show an example. So here is one where I've clicked on the 14,000, the opportunity that we have, those that have not been screened and have not been in for their annual checkup either. So maybe we want to see, do we have appointments scheduled? Do we want to, print the list out or export the list out and give it to somebody in our practice to start getting these patients in? So the patient list shows the name of the patient, the provider the patient belongs to, in case it's more, we're looking at the whole practice and not just yourself. The last screening that was done for that patient and when the next appointment is. So it's an actionable patient list that's really useful to export out and function. Again, if I wanted to see those that were at risk in the 5 to 9 and maybe follow up and have somebody at the practice follow up with them and see how they're doing, you could click on that yellow section of the bar and just get those patients and then take action on them as well. The last thing to show here is there's a little additional drill down underneath the upper right hand corner of that section, and all the pages will have this eventually. Depression screening needed it right out of the gate. There's a lot of complexity here. There's a lot to this initiative. And so we wanted to make sure that you didn't have to go to a lot of different places to find information about what this really means to you and what we want you to do with it, who you can contact at AHP. And so every component will be a little bit different. The depression screening is quite verbose. There's a lot to it, but it's a summary where you don't have to go out anyplace else. It's an explanation of the process, the description of the program. It links you to our depression screening toolkit on our website. And most importantly, who are the key contacts within AHP that you can reach out to. And just two other quick things. We've got a couple hover over sections. When you get into the live dashboard, there's all kinds of things that'll pop up when you're moving your mouse around. And this is just some examples. When you hover over the bar, you see just a call out of the number of attributed patients, the baseline screened, and the target. And so this double dotted line is the number screened last year. The bolder dotted line is the target for this year. And so you can see there's always an incremental improvement year over year above your last year's performance, or if you are exceeding our overall, you'll just be seeing our overall network goal for everybody. And your dotted line would be above that goal. We don't want you to go back, but we're not going to consistently hold you accountable for getting better and better over when you're already a stellar performer. And then the other thing to call out is an I. In different places on the dashboard, you see this I. That's an information call out. And so a lot of times we use that for definitions. And so here, this was what I was describing. What's the patient panel? It's patients 12 and over, those screened who have been screened, and no screening and annual checkup. So this is where you go to find out a little bit more about what exactly those colors mean and what's the verbiage. So we will move on to pharmacy. We're getting close to the end here. So pharmacy costs, this component's going to change. When you see 1.8, it's going to look quite a bit different. This is an overall comparison for you against the network as a whole. And as we decided how to most equitably and fairly structure the reward for pharmacy, we realized that we need to take into account those scenarios where you may only prescribe in 3 out of the 4 pharmacy initiatives. And so, it's not everybody's prescribing it on all 4, and you can't compare everybody exactly the same. So this is going to be actually broken down into the 4 pharmacy initiatives that you could be participating in. If you're not participating, you don't prescribe in any of the pharmacy initiatives, this component would actually be blank. And you'd see the top here, but nothing would be below. If you prescribe it 2 out of the 4, you'd see 2 listed here. But where you drill in is where the magic happens. And this is where, again, the graph at the top is the 4 pharmacy initiatives: insulin lispro, long-acting insulin, metformin, ER, and NICADs. There might be a 5th or 6th. The next year we might drop one. This will be variable for each year, as some initiatives get retired and some new ones start. If we were going to start one this year that we wanted to work on next year, we'd likely add another drug class to this graph. But what you wouldn't see that's coming in version 1.8 is there's no target for you. And it's not factored into the reward this year. We're not going to change the game midway through the year for you, but we're going to try to give you information to give you the chance to start working on things early. And if something retires, it drops off the grid. But what's missing from here is that of these drug classes, what was your performance last year? What's your target this year? And how is the network as a whole doing? And so we've got to add some lines in here and some hover information. This is one that's doing really well. The greens, again, remember, those are doing, those are above average, and those are hitting their maximum performance for that reward. So out of 4, they're getting 50% of the pharmacy reward that they're possible for. But there's 2 drug classes that there's an opportunity. And the patient list down below is what's really important. If you click on any one of the bars, it will filter the patient list down to just that drug class. So say we wanted to see what can we do around long-acting insulin. I would click on that. My list would change just to those patients. So I can see those that there is an opportunity. They're on the more costly drug. And this is the low-cost alternative that we're suggesting. I've blinded out the patient name, the date of birth, who's the PCP, if we're seeing this at a practice level. But note, we're looking only at the last fills for the last 4 months, because earlier in the year, you may have done some switches and they may already have filled their prescription. So it takes a little bit of time for us to see the data come through. Where you have switched somebody over, and that's why we don't finalize the reward calculations until 2 months past the end of the year, when we get a couple months of claims in, and that those patients that you may have switched in November and December have actually filled their prescription, and we've seen it come through in the data. The other thing to note is that we understand there are reasons why you may not choose to switch a patient's medication. And the pharmacy team will do a patient review with you. If you want to call out a patient that's on the list as being more costly, and we don't want to count that against you in the reward calculation, you reach out to the pharmacy team and tell them you have somebody that you're unable to switch, and they would do a clinical review with you. And if they agree, they mark, we go in the back end and we mark that as a reviewed no switch status. And so that pulls that out of those that we are trying to change. It improves your performance and gets you closer to that full pharmacy reward. But it does require that pharmacy review and us to adjust the data in the back end for you. A couple of call outs here also is this is a really good patient list to download, right? Some of those that you want to review in your charts. Let's get it out to Excel. And if I just downloaded it to PDF, all I get is what I see on my screen. So the patient list could be actually more than what you're seeing. So we want to be sure that we're downloading it out. Data will be grayed out for you. You won't be able to pull down data. And what data is in the dashboard context is data behind every single component. So the data behind the name, data behind the graphs. I mean, it's too much. It's not important to you. What we want you to be able to download is the data in that patient grid, that table. And that's called a crosstab. So you see, actually, it looks like a little table anyways. And this is, I think that's the only intuitive part of this whole process is that it does look like the table that you're trying to download. So you would, in the upper right-hand corner, there's a little drop-down download icon. And again, this is page 2 of our FAQ that you can download and print out from our homepage, our website. The drop down, select crosstab. When you do that, you get popped up this crosstab choice. So there's a lot of pieces to that dashboard component. We want you to download the patient list. Unfortunately, we can't hide all the other things. They're always there. So what we did was we named it so it was either at the beginning of the list or at the end of the list. Well, of course, we couldn't get it to be the first thing. So unfortunately, it's the last thing on the list. So just you get this download crosstab, scroll all the way to the right, pick the last one. And it's always going to be named _ patient list. So you're not hunting for it. And then you choose Excel or CSV and click download. The download goes into the bottom of your browser. As most downloads do, you can go to your downloads folder and your spreadsheet will be right there, right for you. And I got a blank page. We're going to go back to the home page and take a quick look now at LARC. LARC is going to be coming in version 1.8. It's a very simple process this year. We've got trainings that are scheduled and available throughout the 4th quarter. And all you got to do this year to earn that piece of the reward is attend one of the trainings. And so this might look a little bit prettier when we put it out in version 1.8, but this one just shows that we're not compliant because you didn't complete the training. It's got a teeny little blue box here. We want to get a big green check mark that you completed the training. The drill down here will probably just go to some details like these are the dates of the training and who to contact to schedule for the training, just to make it easy. And then the blank spot, there's room for growth. And as we do more things and add more things and turn it on or turn it off, you'll see some of these blank tabs as well. So I've left a couple of minutes for questions. Okay, I see some in the chat.
Yeah. Is pharmacy cost only for prescriptions the provider writes, or is prescriptions prescribed for your patients by all providers? I believe it's only for those that the provider writes.
Correct.
That's one of our big differentiators from our friends to the north of town, as we try not to grief the provider over what your consultant physicians are doing for your patients. So it's only those that you are prescribing.
Yes.
For Jen's question relative to depression screening, is the depression initiative related data coming from claims coding or right from our EMR?
It comes right from your EMR. That's the best data that we have to work with. If there's anything that adds value in the claims, and I'm not sure that we're finding that right now, we would certainly, use claims as well. But I think the best information we're getting is out of the EMR data because we want the actual scores. And then follow-up is something that you're going to be able to document in your EMR that it doesn't really come through in the claim. One of the things for follow-up is an appointment, but that's not always possible in the 30 days. So the follow-up documentation in the EMR, when we get to that point on that initiative, is what's important. So we're always focusing on your data first.
Ed, for your question, to the add-on to Carol's, it doesn't affect you. Specialist prescribe what we really are. We try hard to ensure that the things we incentivize you for are things that you have the power to move. And what your consultant physicians are doing is not one that's really always within your power. So it is not included in this data or anything that you're held accountable to change. And with regard to these drugs, Carol, that are part of this incentive plan, that's why it's not considered. This isn't something for in a pediatrician's reward plan. You're not going to be accountable for any performance on pharmacy. But as you say that, I want you to know that that's something that our new director of pharmacy, Bob Adams. I don't know if anyone's had a chance to meet him, or you would have seen him if he was on the call for our clinical grand rounds. I've been talking to him quite a bit about, what can we do in the pediatric space in pharmacy? It's not an area where we've given providers a lot of support. It's all been adult focused. And I think a lot of that's driven by, that's the big dollar opportunity is in the adult world in pharmacy. That said, you deserve support, expertise, there's someone to go to with your questions for medication management. And it is on his radar and something that he is thinking about and processing about what can we do for pediatricians. So right now, we recognize there's a need, and I'm working with our director of pharmacy on filling it for that consulting piece to give you some access to some expertise. But we're not going to hold you accountable for a cost performance initiative in pharmacy right now. So those don't apply to you. We do try, I'm proud of our record on that, as we try and be reasonable. We try and incentivize you for the things that you have power to change, and not hold you accountable for the things that you don't. And certainly also try and work with you as Christy had mentioned, for those adult providers that, that is an opportunity. They are held accountable in that space. If there are patients for whom a switch is not clinically recommended, we want to work with you on that and take them out of the denominator. So, in anything along the way, as the reward plan grows, as we grow into it and live into it, where you see opportunities where you need, or certain areas where you guys need more flexibility or consideration, we want to hear about it and hear you out and adjust accordingly. Any other questions? Carol, I did my colleague Cherie Turpin will be reaching out to you shortly. There's a couple of steps we still need from you to complete your guest account process. So Cherie will be in touch this morning with you. Okay. And for everyone else who has sent in their list and maybe haven't heard back, we're working on getting those guest accounts gone or get those guest account emails out the door. And they're on their way. And we will be following up with you if we don't see things happening, just to help, we know there's a lot of steps in this process, and we want to support you all along the way. Anything else we can answer for you or help you with?
No, thanks. That was great. Christy, thanks a lot.
Thanks.
You're welcome.
Thanks for coming so early in the morning. We appreciate your attendance. The Christy portion of this has been recorded and will be uploaded if you want to reference this session later. But with that, we'll wish everyone a great day, and it's Thursday, so let's just have a great weekend.
Thank you. Take care.
Can't get here soon enough. That's all I can say. Take care.
Bye-bye.
Thank you, everyone.
Thanks,
Bye,
Ryan.
Ed.
Thanks, Christy.
Bye, Katie and Jen. See you later. Jane, I'll talk to you later. Christy, we've got a one-on-one.
You got it. Bye.
All right.
Bye, guys.
Bye.